www.healthcmi.com. Acupuncture continuing education online today. Acupuncture relief of nasal allergies confirmed. Acupuncture soothes nasal allergy symptoms. Investigators at Beijing University of Traditional Chinese Medicine Affiliated Hospital conducted a meta-analysis of 30 independent clinical trials with a sample size of 2,602 allergic rhinitis patients, and they conclude that acupuncture, either used alone or in combination with other treatments such as moxibustion herbal medicine and Western medicine, were proven effective to have both short and long-term benefits to allergic rhinitis sufferers. So allergic rhinitis is an inflammatory disorder of the nasal mucosa induced by allergen exposure, which then triggers a response. In other words, the body kicks up a lot of IgE-mediated inflammation. So this affects approximately 40 to 60 million people in the United States alone. In this study, acupuncture was proven effective, again, as a standalone treatment modality, but also in combination with other types of treatments. This is also consistent with what the National Institutes of Health in the United States states. If we go to the NIH website, we see that it states, there are data from some randomized controlled trials that suggest that acupuncture may improve symptoms of allergic rhinitis as well as quality of life. They also note that the American Academy of Otolaryngology states, quote, clinicians may offer acupuncture or refer to a clinician who can offer acupuncture for patients with allergic rhinitis who are interested in non-pharmacologic therapy. They also quote a meta-analysis of 2,365 allergic rhinitis patients and quote, compared with the control group, the acupuncture treatment group had a significant reduction in nasal symptom scores, medication scores, serum IgE, and an increase in quality of life scores. In addition, the NIH website notes that, quote, there are high-quality randomized controlled trials that demonstrate efficacy for acupuncture in the treatment of both seasonal and perennial allergic rhinitis. So this is emerging that the science definitely substantiates the use of acupuncture. So allergic rhinitis is characterized by rhinorrhea, so that's thin and primarily clear nasal discharge or runny nose, sneezing, nasal itching, and nasal congestion. But it's also associated with a decreased concentration or focus, irritability, sleep disturbances, and fatigue. This impacts the quality of life and reduces work productivity as well. So what's important is that while antihistamines and other medications can quickly control the symptoms, an acupuncturist is looking for a more long-term solution to benefit the person's health. In Chinese medicine, we're doing something called benefiting the Wei Qi. And basically, you would translate into a biomedical conceptualization of Wei Qi as strengthening the immune system. So this is the goal of an acupuncturist. If you'd like to learn more, visit healthcmi.com, click on news, and you can read the full article published at healthcmi.com's news department on April 26, 2018. I'm Adam White, licensed acupuncturist. Thank you for listening. www.healthcmi.com.